Hemodynamic. The blood vessels are divided into aorta and large arteries, then arterioles, capillaries, venules, veins, and each type of blood vessels performs specific function. For example, aorta, due to elastic recoil, is able to accumulate the energy of the cardiac output and propulsing the blood into the small arteries and arterioles, which produce the highest resistance to the blood flow. They may be called resistance vessels, especially arterioles are resistance vessels. And then capillaries, where the exchange of fluids and nutrients and different compounds occurs between the blood and interstitial fluid, the cells surrounding the blood vessel. And then veins, venules and veins, which collect the majority of the blood volume and where the blood flow is the lowest. So we will start now with the mechanism of exchange of fluids through the wall of the capillary, because it is the very important function of the cardiovascular system. So we will draw the capillary, we will indicate the direction of blood flow, we will show the arterial and the venous end of the capillary, and we will indicate the hydrostatic pressure. The cells surrounding the capillary, and hydrostatic pressure in the arterial part of the capillary is 40 millimeters mercury. In the venous part it is lower, it is only 20 millimeters mercury. The blood pressure decreases from aorta to veins because the energy of the cardiac output is lost due to the resistance of the vascular wall. Another factor that influences the exchange of water in the capillary is oncotic pressure. Oncotic pressure is 30 millimeters mercury, and it is the same, equal in the venous part of the capillary, so it is also 30 millimeters mercury. Oncotic pressure is a type of osmotic pressure, but oncotic pressure is produced by proteins only, proteins which are accumulated in the blood due to albumins, first of all, also by globulins. And because the proteins are accumulated in the blood plasma and they remain in equal concentration in arterial and venous part of the blood vessel, the oncotic pressure is equal. If we will summarize these vectors, then in arterial part of the capillary we will have the resulting vector 10 millimeters mercury, and this force direction is from the blood vessel. So therefore in arterial part of the capillary, the interstitial fluid is moving outside, and it carries glucose, nutrients which are needed for the cells, for their nutrition. And after the metabolism going on, the cells release waste products, and in venous part the resulting force is 10, but it is directed inside. Therefore, these waste products are reabsorbed in the venous blood and carried away by the blood from the tissues. So the tissues are losing these waste products due to that mechanism. It is important that the balance should remain between the filtration and reabsorption in the capillary. If, for example, the organism loses proteins, or maybe liver problems may also induce deficiency of proteins, because liver is biochemical factory of the body, and if the proteins are not synthesized, then oncotic pressure will decrease, and if it will be less than 20 in venous part, then reabsorption will not take place, and edema will be the result of such situation, which also may be observed in the case of kidney diseases, when kidney filter is not working properly and organism loses proteins. Proteins are found in urine in that case. So it is really a problem, because oncotic pressure decreases and edema occurs primarily on the face of a patient. If the venous pressure increases due to the insufficiency of the cardiac muscle, for example, then also cardiovascular edema will be observed. So if hydrostatic pressure in venous part will increase, so that will be the cause of edema on legs predominantly, because in legs the blood pressure increases due to gravity too. So as we can see, the hydrostatic pressure is very important parameter of the body. It should be optimal. So let's discuss some hemodynamic parameters of the cardiovascular system. We will draw the graph. On that graph, we will show the different types of blood vessels. We will show aorta, arteries, arterioles, capillaries, venules, veins, and large veins, vena cava inferior and vena cava superior, vena cavas. So all types of blood vessels, and on vertical axis we will show blood pressure first. So blood pressure. So in large arteries like aorta and others, the blood pressure changes. It is not constant. It depends on the phase of the cardiac cycle. So systolic and diastolic. And then it decreases, and in arterioles it decreases abruptly, because arterioles the resistance blood pressure, and Sechenov called arterioles the faucets of the cardiovascular system, because arterioles do have prominent muscle layer, so they can constrict and dilate, and they can adjust the circulation in different organs in accordance with the metabolism level. Okay, in capillaries, the blood pressure is between 40 and 20, as we know already, and then blood pressure decreases even more, and it may be negative in large veins. Especially, it should be mentioned that the blood pressure in large veins, in vena cava superior and inferior, depends on the phase of respiration. It may be negative, it means less than atmospheric blood pressure. So it is dangerous, because in case of the wounds in the neck area, air embolism may occur. The air may go into the bloodstream, and air bubbles may stop the circulation. So such wounds should be closed carefully to avoid that complication. So this is the graph of the blood pressure in different parts of the cardiovascular system. Now we will draw another graph showing the velocity, linear velocity of the blood flow in different types of blood vessels. We will use red color. So the linear velocity is maximal in aorta and is minimal in capillaries, and in large veins it increases like that. So in aorta it is 0.5 meter per second. In the capillaries it's 0.5 millimeters per second. So such distribution of the linear velocity v is explained by another graph, which will indicate the total cross-section of the blood vessels of each type. We will draw this graph with blue color. So this graph will look like that. So this is the surface of the total cross-section. What does it mean? It means that the cross-section of all capillaries will be much higher than the total cross-section of aorta and vena cavas. So the surface of cross-section is inversely proportional to the linear velocity. The more is cross-section, the lower is the velocity, and vice versa. So that's why in the aorta the linear velocity is maximal, and in capillaries it is minimal, because the sum of all cross-sections of each capillary is huge in comparison with the surface of cross-section of aorta. And another graph that we will show is the volume velocity. The volume velocity is constant, is indicated usually by Q. It shows the volume of blood that passes the unit of cross-section per unit time. So the system is closed, cardiovascular system, so that's why the Q is constant. Okay, so now we will speak about the blood pressure again, and we will discuss what factors determine the normal blood pressure in the body. So to remember the factors that determine the blood pressure, that is crucial, again we will repeat that for the body. We will use the formula 3 plus 1. 3 factors plus 1 additional. So the most important factors that determine the blood pressure is activity of the heart. Activity of the heart. Because the heart is a pump. So without pump, the blood pressure will not be observed. In the corpse, the blood pressure is 0. So the most important factor is activity of the heart. The second factor is vascular resistance. The vascular resistance is explained by Poiseuille equation. In accordance with that Poiseuille equation, it depends on the viscosity of the blood, but predominantly it depends on the radius of the blood vessel. Because in that equation the radius is power 4. So by slightly changing the radius, the organism will efficiently change the vascular resistance. So summarizing, the blood pressure will highly depend on the inner radius of the blood vessel. Third factor is the volume of blood volume. Volume of blood. The blood volume may decrease due to the blood loss, for example. It may also increase. So this factor is important. The more is blood volume, the higher is blood pressure, the general rule. And plus 1. So what is the additional factor? Additional factor is redistribution of blood. What does it mean, redistribution of blood? Means that blood may be excluded from the circulation and may be stored for a while in special organs which may serve as a depot of blood. Such organs which may collect the blood are liver, spleen, lungs, and adipose tissue, skin adipose tissue. So the amount of blood is only 5 liters approximately in the body, and it is not enough for all organs to maintain the normal blood pressure. So to maintain the normal blood pressure, in the case if all blood vessels will lose their tone, the volume of blood that will be needed is 20 liters. We do not have 20 liters. So that's why the important factor that is playing the crucial role in the maintenance of blood pressure is the vascular tone. So vascular tone may change the radius, the inner radius of the vascule of the blood vessels, and is very important for the redistribution of the blood pressure. So now we will discuss the regulation of the vascular tone. As usually, when we speak about the regulation of functions in the body, we should mention the nervous and the humoral regulation. We will start discussion with nervous regulation. So nervous regulation is produced by autonomic nervous system, and it is important to know that sympathetic nervous system regulates the vascular tone. The blood vessels almost do not have parasympathetic innervation, so except heart, pelvic organs, and some other exclusions. So predominantly the blood vessels receive sympathetic innervation. And for the majority of blood vessels, you may remember, the sympathetic nervous system constricts the blood vessels. It was proved for the blood vessels of the skin in the experiment of Claude Bernard on the white albino rabbit. So Claude Bernard experiment. So he took white albino rabbit and he cut the sympathetic nerve that innervates the blood vessels in the ear of the white albino rabbit. So after he cut the sympathetic nerve, the ear became dark red on the side of operation. So the blood vessels dilated because sympathetic influence on the vascular tone disappeared, and it caused vasodilation. So this experiment proved, Claude Bernard experiment proved, that sympathetic nervous system increases the vascular tone. So you may ask how the blood vessels dilate in that case if sympathetic nervous system only innervates the blood vessels. So two explanations. First explanation is that blood vessels may dilate themselves because they are filled with the blood. So blood itself may dilate the blood vessels. And secondary, the decrease of sympathetic tone will result in the dilation of blood vessels. So it's the nervous regulation of the vascular tone. Now it's also clear that during this high stress the person gets pale because blood vessels constrict. So humoral regulation of the vascular tone. Here we have many hormones and factors, metabolites, which adjust the vascular tone. The well-known factors are epinephrine or adrenaline, which may increase or also may decrease the vascular tone. It depends on the receptors. We know alpha and beta receptors for epinephrine. So alpha predominantly constrict, beta receptors, if stimulated, beta receptors are stimulated, dilation may occur. So, but adrenaline is well-known factor that adjusts the vascular tone. We will also mention here histamine, tissue hormone that dilates the blood vessels. Allergic processes connected with histamine release, and the redness of skin is explained by this histamine effect upon the blood vessels. We may mention nitric oxide. Nitric oxide dilates the blood vessels. Vasopressin is produced by hypothalamus and released in the blood in the posterior lobe of pituitary gland. Vasopressin constricts the blood vessels. Metabolites, carbon dioxide, for example, lactate, they dilate the blood vessels. And very important humoral factor is angiotensin 2. Angiotensin 2 that constricts the blood vessels, and it participates in so-called renin-angiotensin aldosterone system. So we will describe this system in details. This system is initiated by the juxtaglomerular apparatus in the kidneys. So when the renal blood pressure acutely drops, so when the volume of blood, for example, decreases due to the blood loss, or if the renal artery is blocked by the clot, for example, so if the blood flow decreases, then the juxtaglomerular apparatus produces, the kidney releases renin. The renin is enzyme. Enzyme that is called peptidase. It cleavages angiotensin 1 into angiotensin 2. Oh, sorry, angiotensinogen. Into angiotensin 1. Precursor of angiotensin 1 is converted into angiotensin 1, and then angiotensin 1 is converted by angiotensin converting enzyme ACE into angiotensin 2. The main player, angiotensin 1, is very active peptide. It has vasoconstrictive action, constricts blood vessels. It accelerates cardiac activity. It stimulates aldosterone release from adrenal cortex, and aldosterone is decreasing the volume of urine. So it's very good in that case, because if the blood flow decreases in kidney due to the blood loss, then aldosterone will decrease the production of urine and will save water in the body. Another effect of angiotensin 2 is it stimulates the thirst, drinking behavior. The organism drinks, it is searching for water, looking for water, and it should compensate the decrease of blood flow. It compensates the volume of blood, and it accelerates the kidney circulation in kidneys. It is good to remember that angiotensin converting enzyme is the target for the anti-hypertension drugs. So the modern medication for hypertension is aimed to the block of ACE. So if we will block angiotensin converting enzyme, then we will decrease the blood pressure in the body. So now we will speak about the regulation of the blood pressure. And to discuss this topic, we will draw the functional system of the optimal blood pressure. As usual, we will start to draw this functional system with metabolism, and we will show that there is a close relationship between the metabolism and the optimal blood pressure. So the optimal useful adaptive result is 120 to 80 millimeters mercury. So the adaptive result of this functional system, the goal of this functional system is the optimal value of blood pressure, 120 to 80. So this is not very constant parameter of the body, because blood pressure changes in accordance with the metabolic needs of the body. Physical activity, emotional stress increases blood pressure, because the increase of the blood pressure is leading to the increased permeability of capillaries for nutrients, as we already know, and it is a contribution to the metabolic rate of the body. It contributes to the satisfaction of the metabolic needs of the body. Okay. The blood pressure also is different in different blood vessels, as we already know. So this parameter is not very stable. It is a plastic parameter of the internal environment. The next component of this functional system, and very important one, is the baroreceptors. Baroreceptors which monitor the blood pressure. They are in fact nerve endings, mechanoreceptors, located in the vascular net, and the concentration of baroreceptors is extremely important in aorta and in large arteries, like, for example, carotid artery. Carotid sinus is the reflex area with high concentration of baroreceptors. Carotid sinus is located in the bifurcation, in the place where common carotid artery is divided into internal and external carotid artery. Baroreceptors produce high frequency of spikes when blood pressure increases. So we will draw it here. So BP, when BP increases, then the impulses in the special nerves which are beginning in the baroreceptors, reflexogen areas. So the frequency of impulsation, this is spikes. The frequency increases, and these impulses through the special nerves are directed into the central nervous system. In the central nervous system, we may find also baroreceptors. Therefore, we can draw also such link directly from the blood pressure to CNS. So this is the feedback afferentation from baroreceptors to the CNS. And here we can find in CNS, in the brainstem, the vasomotor center. The structures of the brain which fulfill the function of vascular control. So they control the blood pressure in that case. So also in CNS we may distinguish other structures. Even brain cortex may participate in the regulation of the blood pressure, and limbic system, hypothalamus. Together they work to optimize the blood pressure. What mechanisms will optimize the blood pressure? Actually, we can remind the formula 3+1 that we already know. Here there are several ways to control the blood pressure. Humoral regulation and autonomic mechanisms will take part in this regulation, and we can feel in this functional system the precise mechanisms that we already know. The activity of the heart, cardiac activity, will change. Vascular tone, as we know, is very important factor. Vascular tone. Then function of kidneys, kidney functions. Urine volume may increase or decrease. Liver, so the depot of blood will increase or decrease in correspondence with the blood pressure change. Also viscosity of the blood, hemopoiesis, and vice versa, the destruction of blood. Hemopoiesis, it is the production of new blood. And other mechanisms, but all these mechanisms will fit to this fine formula 3+1. Also, we have shown cortex, and we can draw external link of regulation. As usual, the external link is behavioral regulation. Behavior takes part in the regulation of the blood pressure. We know it because, for example, if the person has a high blood pressure, it may relax, or if he has hypertension disease has developed, he may take drugs, for example, that block angiotensin converting enzyme. So it's behavioral regulation. And vice versa, if the blood pressure is low and person feels dizziness when he stands up, he may drink coffee, for example, to increase blood pressure. So behavior may also attenuate the blood pressure. Next question that is very important is we should explain the mechanism of hypertension, very widespread disease when blood pressure in the body increases stable and stays high and more than it is needed for metabolic needs, even when person is not performing physical or emotional tasks. But so it's dysregulation of the blood pressure, and we should analyze why it is so widespread. Around the world, the hypertension is leading to vast majority of complications, cardiovascular diseases like stroke, like cardiac infarction, and it is the general cause of death among the people, all in the whole world. So we should analyze now the mechanism of this hypertension. And it was found that the key mechanism of this disease is emotional stress. So emotional stress that is relatively widespread in the world due to the progress of technical progress and informational progress, and people are stressed, and blood pressure increases because in old time each emotional stress was followed by physical activity. You could understand that the aggressive, the wars, the aggressive animals that were dangerous, they induced high blood pressure because the muscles in that condition had to be active. But nowadays, of course, the muscles are not so important for these situations. But instead, this high blood pressure changes the functional activity of baroreceptors. What does it mean? It means, and it should be remembered, that baroreceptors adapt to that high blood pressure. Adaptation of baroreceptors takes place. What does it mean, adaptation? Adaptation means that when some factor produces long-lasting effect, the sensitivity of receptors decreases. So we know that property of receptors, for example, in the case of mechanoreceptors of the skin, if you press on the skin by a ring, for example, finger ring, after a few days you lose the sensitivity and you don't feel the ring on your finger. The same thing, almost the same thing, happens with baroreceptors. If the person is continuing to live in condition of high blood pressure, his baroreceptors adapt and do not send information to the CNS that signalizes about the high blood pressure. So they remain silent. And that's why there is no mechanism to decrease this high blood pressure. So, and the person gradually develops hypertension. So what should be done to avoid this severe complication? It is the very simple thing. Person should change the activity in such a manner that after each stress with high blood pressure, there should be relaxation when the blood pressure will drop. And new stress should be always after such period of relaxation when blood pressure normalizes. So if a person is able to achieve such relaxations and normalize the blood pressure, then baroreceptors will not adapt and hypertension will not develop. So stress is okay, but after each stress there should be a good relaxation. That's why now we will stop this lecture to get this relaxation.